Well, ma'am, thank you very much, first of all, coming to our event. So, my questions goes like this. So, how is the healthcare system you think is being transformed in our country, and how do you think is the government helping us?
Yeah. Thank you for inviting me here in the Elets Health Summit, which is taking place in Delhi. I am Padma Jaiswal. Let me introduce myself. I am Secretary Information Technology with Government of Puducherry. So, well, you have asked the question about this healthcare transformation taking place these days. Well, yes, with the intervention of IT and the exponentially how the technology is increasing the worldwide and also taking place everywhere, yes, it is having the impact in the health sector also. So now the healthcare is not just only about the tertiary care, or when you have some chronic illness, you go to get it treated from the doctor or in the hospitals. It is also about it is more, has become the outcome based. It is more about preventive, and it is more about like taking some preventive measures so as to we can avoid that incidence of that chronicity which takes place in the later stages. So it is just about the holistic and comprehensive. It has become a holistic and comprehensive concept where we can just take care of the citizens so that it can increase our GDP of the country. Yeah, which ultimately helps in the development of the country.
Yeah,
Yeah.
sure. So, talking about the public-private partnership, what is your take on the same? And if you could mention, some streaks from Ayushman Bharat.
Yeah. See, this is one of the steps which the government has taken recently to incorporate, the participation of the private sector in the health, because government is plays only a catalytic role, and it is only a facilitator, and it cannot just it is withdrawing itself from the implementation. So we need, if we want universal health coverage, or we want to implement our sustainable development goals, as the UN United Nations have told. So it health for all. So it is not possible, if we don't incorporate private sector. So it is the private sector only which brings about innovation, which brings about investment into the economy, and also which implements various kind of examples in the standardized practices from the other countries also. So this is also Ayushman Bharat is also one such step where the government has tried to approach the problem of the healthcare in the holistic manner, taking into account the primary, secondary, and the tertiary care. So in Ayushman Bharat, we are dealing with the private sector, and they have to be impaneled, and then holistically insurance. The government provides the insurance of the citizens, and they provide the services and are being paid by the insurance companies. Yes. And also, this is what I was talking about, implementation in the tertiary sector. But Ayushman Bharat is not just about, giving the insurance payment to the private sector for the delivery of services. It is also about, creation of wellness and healthcare centers. So our primary units, or in the various respective places in the field, are being converted into wellness and healthcare centers. Yeah. Yeah.
So, considering that private partnership has not been like an ever-going sort of a process, what is the percentage of change which you see with the inclusion of private sectors?
Yeah, see, actually, the government health sector in India is totally an unexplored domain. The potential of the health sector in the country is 200 billion, whereas we are just only a 2 billion health sector in India. So there is so much of the potential which has to be explored, and the market is totally unexplored. Even we have not explored the tip of the iceberg. So, and without the investment from the public sector, private sector, or the participation of the non-governmental organizations or the voluntary organizations, we cannot, meet this goal of health for all. So, the government is trying to, like give certain kind of incentives to the private sector so that they can innovate, they can go for some research activities by incorporating the information technology, and they can, because if you see the research also, since we have really make some progress in the genome exploration, and we have mapped down the genome at a very, very lower rate, lower prices. Now, like in the year 2000, when we were mapping the genome of a human, it used to take about $1 billion, but now it can be mapped in about $1,000. So because of this increase in the computational speed of the computer, we are able to map this genome very, very cheaply. So now which can have other spillover benefits for the other people or the country at a large. So when we, after mapping the genome, and if we come out with the precision drugs, so we'll be able to target our audience or our health patients much more effectively as it used to be previously. Now we are focusing on the precision drugs, not on the bulk drugs. So in this, the participation of private sector is required, and various kind of innovators is required, and government need investment, and government need expertise and skills of the private sector.
Considering that you are from Puducherry and the healthcare system is pretty developed there, how do you think that the developed system of Puducherry can lay an implementation onto other states?
Yes, see, Puducherry is very developed when it comes to being social and economic indicators. It has got very good indicators. It is at its highest average at all India level. And of course, Ayushman Bharat, one of the projects of the Government of India, has been very successfully implemented in Puducherry. And so we are now not focusing only on treating the diseases, but also on preventing the diseases. See, the idea behind this is that the government is spending so much of, government is allocating so much of budget in the health sector. So, but this all cost can be saved if we manage to prevent. Because you will be agreeing with me that when a particular chronic disease is being treated, it attracts much expenditure. Whereas if we can make some efforts to prevent that disease, maybe no expenditure is required at all. Only a kind of awareness is required at the people at large in their minds that yes, this particular thing can cause this disease and I don't have to go for that. So awareness is very important. So what we are doing is that government, is now taking a holistic point of view in framing the environmental policies, in framing the smoking or the other kind of a social taboos policy, and also in terms of dealing with other kind of various kind of educational policies where we educate people and create awareness in the minds of people that what is good and what is not good for them, and what kind of nutrition the people has to take in order to stay healthy. So that this is called the primary healthcare. So Government of Puducherry is focusing more on these kind of primary policies. And also when we are also taking resort to some kind of technology, we are building certain apps. Okay, we are building apps in the form which is giving some information to the patients that what kind of treatment they require, what kind of line of treatment they require, so that the disease, the chronicity of the disease can be delayed by 10 years or 15 years. So if a particular incidence of disease is delayed by 10 or 15 years, then I don't need to spend so much of expenditure at this point of time, and maybe I can deal with the disease and management of the disease more effectively. So the Puducherry government is focusing more on the preventive care, and also the tertiary care is quite developed. So the learning experience for the other states would be that we should try to focus more on the primary and the preventive care, so that it will also amount for the government saving on much of the expenditure which the government has to spend on setting up various hospitals and provide out of the state infrastructure in that hospitals to deal with the chronicity of the diseases, and also to appoint new doctors, nurses. So if we focus more on primary health care, then this kind of expenditure will be saved by the government, and which can be spent on the other activities. Yeah.
And talking about the intervention of IT into the industry, I mean, how do you think it's proving as an advantage for all of us in order to boost the healthcare segment?
Yeah. Actually, the healthcare sector is the only sector so far which has not, assumed the global proportions, because we have progressed in online, payments, online shopping, retail, banking. We are totally interconnected when it comes, globally when it comes to these two sectors. But when it comes to health, we are not connected with each other. There is very less inoperability. Whatever records which are lying in my system about my patients are only there with me. I cannot share it with others, or I cannot share those records or that data with the other systems of the other countries or the other states. So this kind of inoperability is absent, and so the need of the hour is that we have to connect our medical records, and also have to share the data internationally and nationally. Of course, the privacy factor has to be taken into account while we are sharing the data, but it is very important, because if we want to explore, the artificial intelligence, blockchain. This cannot be explored until and unless we have some large amount of data. So, and because we are, tripling or we are exponentially increasing our computational abilities of the systems, so the data is very necessary. And it will only come when we share our data, when we have large amount of data, when we don't have any leakage of data, when we tap each and every data which comes to us about the patients. So this is very important. IT plays a very major role here. Then of course the research and development, IT has to play a very major role. Development of medicines, drugs, all these things, and then the care, the disease care management by the various patients. That has to be done with the help of the IT techniques, and the diagnostic and therapeutics, that is also IT plays a very important role in it.
Okay. And talking about the various startups which are emerging, so we have startups like Practo. I mean, I wouldn't call it startup as per se, but then they have created a platform wherein patients like us, we can actually have our records safely and sound, wherein we don't need papers anymore, and which is cutting down on a lot many other aspects. So just now you mentioned that data is one thing which needs to be preserved, and wherein it's difficult for people like you, wherein the data is only kept with you and you cannot share it with others. So coming in of platforms, I mean startups like Fracto, I mean, how do you think it's going to affect the ecosystem?
So I can just tell you one thing, that the ecosystem in India is very different from the ecosystem abroad. Because in India, government is the only key functionary. And the other institutions like universities or maybe the major hospitals or the private sector are not equal to government. Whereas in the other developed countries, it's not happening like that. The data lies with the university, the data lies with the other private sector. Government is not the owner of the data. So we have to approach the problem of the startups from that point of view, because startups are ultimately, they won't require data, and it is with the government. So of course we are having a data protection bill, this time in the parliamentary session which is going on. I think it's likely to be passed, and then then government will be having some kind of modalities how to share the data with the private sector. And startups are going to play a key role in the health sector when it comes to management of the disease, or maybe creation of some kind of instruments, or maybe diagnostic instrument also, where we can diagnose the disease and we can even cure it. And in, of course, the overall healthcare system, the private sector and the startups are going to play a major role, apart from providing the employment to the youth. And it is very promising because we are the young country and we have got young population. So the startups are very promising, and they have to play the key role. And the startups that you have mentioned, few of them, yes, of course they are doing a very good job, but we should not only have two excellent startups in the whole river. We should have so many other startups also. So maybe because you are doing this health summit, this will create an awareness amongst the people to come out with more and more innovation, and to come in the mainstream of the healthcare, and to contribute their bit.
Right. Thank you so much, ma'am.